Hello, I wanted to give a brief overview of what you could expect from me if I'm going to be working with your child or adolescent or teenager in my office. I am experienced and very comfortable working with children and teens in the areas of ADHD, ADD, anxiety issues like panic attacks, obsessive compulsive behaviors, generalized anxiety, and others, issues like depression, behavioral issues that might typically accompany an autism diagnosis, and some sleep disorders. I am hoping that if you come to see me, as my main role is medication management, I'm hoping that you're already working with a psychologist or a therapist that specializes in working with children or teens. This is not always possible, and it's sort of a tall order right now, especially as there's a shortage in the Omaha area and there's a really long wait to get in to see someone that specializes in children for therapy. This is important to me for a few reasons. The most important reason is that working with a therapist, either working with a therapist alone or in combination with medication management, is in almost all cases the first line approach and will lead to the best outcomes for your child. So that's why this is important to me. If this is not already something you have set up, I will suggest strongly that we do so, and I will make a referral to someone in the area that we can partner up for your child's care. There's some advantages of working with me in my office. I only do mental health. That's my only specialty and the only thing that I'm interested in. I spend a lot of time with your child, up to 1 hour for that first appointment, and then 20 to 30 minutes in the follow-up appointments. We have time to form a therapeutic relationship, which is really important, especially in children and teenagers. I spend time alone in the room as long as mom and dad or legal guardian agrees, because that gives children, usually older children and teenagers, it allows them to open up and discuss issues which really cause a lot of anxiety, a lot of stress for them. They're able to open up and talk about things they might not discuss with mom or dad. That can be very therapeutic, and that can be really helpful for their mental health. I will not always be prescribing medications. People don't want to feel like they're having medications pushed on them, but especially pushed on their children. So if this is not something that's appropriate or not something that you feel comfortable with, then I will just be helpful in making that connection with the therapist, and then be ready in the future to provide assistance if we decide that medication management could be an important part of the treatment plan. If you have any questions about how to get the first appointment started, or if you'd like to schedule for a time to meet with me, or if you have more questions, please contact me at the number above. I'd be very happy to help. Thank you very much.